Hello and welcome again to this week's case study. And my name is Shetemi. I also have with me Patricia, and I also have Roxanne and Lauren. This week we are going to be talking about the second case study 2, and the question we're giving was that we are working. I will say we because the group. So we are working in the mental health setting, providing wellness support to families who have recently moved to Canada. Then a mother and a 5-year-old son approached you. The mother shares that she left her home country after experiencing violence and fear for her son's safety. She discloses that both her and her son have been the victim of this violence. She is looking for help for her son. Now we are to apply the best practice guidelines, and how are we going to build rapport and support this family? Also, what treatment consideration may be appropriate for the son, and why do we think so? So I'm just going to begin by explaining um the 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 rapport, what's actually going through, what's actually happening in this case. And this case, we as a group we see that the situation actually requires a trauma and informed, cultural, safe, and family-centered approach. Especially like we see that there's history of violence, and you can say they have migration stress because obviously that they just moved into Canada. So there's issue of violence and also the recent migration stress. So how are we going to build rapport and when we're supporting the mother and the son? First of all, we can say that we have to use the trauma-informed based practices. Like basically we have to first of all focus on safety, because that is the most important thing here. We have to make sure that they feel safe wherever they are talking to, or wherever they share their worries to, or wherever the mother shares her worry to. So we have to make sure that there's safety. Secondly, we have to see that there's trustworthiness. Because of the violence they faced back in their home country, it will be hard for them to trust any other person. So most importantly, we have to make sure they feel safe, and they feel like trustworthiness, they feel safe discussing their concern to any other person. And so one thing, so I'll mention some few points that can help um, establish a safe rapport and establish a safety for the mother and the child. We can make sure that we speak to the mother warmly and respectfully, and also encourage her that acknowledge and courage that, oh, it takes a lot of strength for her to seek help for her child, because being that she had faced violence, she might be scared, to actually express her thoughts to any other person, thereby dying in silence and all that. But we have to acknowledge the fact that she had the courage to actually speak out for help for her and her child. Also, most one important thing as in this case is confidentiality. Sorry about confidentiality. For the mother to come open and come to meet us for advice, or for safety, we have to ensure that there's confidentiality in whatever she's discussing with us, that so she feels safe that she's in the right hands. Also, we have to make sure that we avoid um pressing, like talking about avoid her talking about the trauma that she feels in detailed. Like for the first time we are meeting, we have to enforce safety first. We don't have to push her to talk about every other thing that she went through in her past, in our country, the violence. So by this, we can use a calm tone, we can use open posture, we can use open-ended questions, just in a way for her to express herself better. And not forgetting that a child is also involved. We have to also make sure that we are discussing a child. The child is 5 years old in this case, and age appropriate language with the child, so the child also can also feel safe. And when we are discussing with the mother and the child, we should not forget that the mother can kind of hyper vigilant, like looking everywhere just to be sure that they are actually safe when they are talking. So we have to make sure we create a physically and emotionally safe environment. So how we create that is going to reduce fear, and that will build trust. So we will and having built safety, in discussing with when the mother discussing with husband in trust, we should also think about applying cultural safety. Because when the new family, when they move to the Canada, to the new country, and Canada in this case, we have to ask them what kind of what language they speak, and the preferred language they want to be spoken to in English, the common language, or they want to be spoken to in their own dialect, in their own language. And if probably needed, we can offer interpreter for them. And also then if we do this will make the mother to feel very welcome, and she'll feel like she's being heard. And also we should just try and avoid any assumptions about parenting or trauma responses. And also we should reflect on how like how our own biases. And also we should remain curious rather than being directive. Like we should, like I said earlier, we should try and ask more open-ended questions. So those are some of the things I feel like how we can build rapport with this mother that just came to express herself. And so I'll just jump into I'll let my colleague take over so I can, at the end of this, thank you. Lauren, you can take over.
Thank you. Yeah, I think we have similar points about how we can build rapport and support this family. I definitely agree with you about safety and trust. Like you said, I would definitely avoid pressuring her to disclose details about the violence and instead, like, just allow her to share at her own pace, which I think is important as trauma informed care emphasizes choice, collaboration, especially in empowerment rather than like re exposing her or like forcing her to tell her story. So I think safety and trust in a trauma-informed approach is definitely accurate. So Tammy, you pretty much covered my points with that one. Um, I think you briefly went over cultural humility and just responsiveness in general, I think is important for this case. I think I would approach the family with humility by asking, like Satemi said, lots of open-ended questions. Um, if any language barriers exist, I would ensure maybe accessing an interpreter rather than relying on like translation between the two of us, just because I want accurate communication that will go towards trust, informed consent. I would also inquire about maybe community connections, any faith practices, cultural traditions, or anything that brings the mother comfort, and explore how maybe those strengths can be incorporated into their healing process. With the child specifically, like it was mentioned that since the child is only 5 and doesn't really have the necessarily like the verbal capacity to articulate their trauma experiences directly to me, I would maybe engage the child to express through play-based activities. This could be drawing, storytelling, like toy figures, anything to allow the child to express in a developmentally appropriate way. And especially rather than asking direct questions about violence, I would probably observe themes through his play and gently, like, kind of analyze the emotions. Um, for example, if like the child said that like a toy character said that they felt scared or looked scared, like this would kind of like validate like the kid's feelings without forcing them to like verbally articulate it, if that makes sense. Um, and with the mother, I would definitely provide psychoeducation about common trauma responses in young children, like nightmares, clinginess, irritability, etc. I think I would also offer emotional support for the mother herself, recognizing that her own trauma symptoms might affect her capacity to regulate her child and encourage her to access like the supports if she was be open and willing to do so. I would also collaborate with her in goal settings for her son's well-being, reinforcing to her that she is, the expert on her own child and that these interventions will be guided by her values, her opinions, priorities. And lastly, I have some notes on holistic and practical supports. So assessing settlement related stressors like housing instability, any financial insecurity, school transitions, social supports, all these factors can significantly impact mental health and overall family functioning together. I think I would connect the family to newcomer services, community-based programs, cultural specific organizations, since they are newcomers to Canada, and possibly any school-based supports to reduce the isolation of the child and maybe strengthen any protective factors. Those were pretty much some of the points I had. I think Satemi and I had a similar outlook on building rapport and supporting the family as a whole. I think now we can move into the treatments, unless Roxanne, Patricia, do you have anything to add onto the rapport and supporting the family?
I can jump in, but I think both of you have basically covered. But some of the things I would look at, and I think you probably have said it, in different ways of stating it, but just ensuring that cultural sensitivity, right? Because based on where they're coming from, the situation at hand, there is a lot of issues with trust. So in terms of like coining, like questions, even though you want to ask, questions, you give a lot of choice, but just make sure that the questions are sensitive, and ask permission to ask some questions, because I'm kind of looking at it from the lens of somebody who is an immigrant, who came here, and sometimes the questions that are asked are not so sensitive. So just be mindful of those the questions that are being asked, and asking permission. Can I ask? Is it okay for me to ask? Maybe just how the phrasing. Does that make sense to everyone?
Yeah, I agree that
Right.
it'll like
Right? Just the phrasing
anybody's.
of the question.
Oh yeah, 100%. Like people's cultural
Yes,
backgrounds definitely shape how they understand trauma and healing.
exactly.
So asking permission to, because I know some questions can be okay for
Triggering.
one person and not for the next.
Yes,
So it's good. I
yes,
agree
yes.
with you 100%.
Yes, yes. And just like, even with communicating with the child, just be at eye level, right? Because sometimes you don't want to be towering over them or standing over them. So just maybe sitting down, have eye level, ensuring that the tone of voice is calm, right? Because of the trauma, intonation can also be an issue, right? And just having that calm, approachable, just ensuring that the body language too is kind of validating their fears and all of that. So that's basically what I would add. I'm not sure if Patricia wanted to touch based on anything in relation to building rapport.
Yes, sure. So, for me, looking at building rapport, I think Shetami also alluded to that. Whatever care we're going to be providing for the son, we also have to include the mom, because so it
Right.
has to come from a family-centered approach, as you know, a stable mom is a stable child. The child recovery is going to be strongly linked to to his mom's stability. So we can
Hmm.
validate our protection. You know how moms can be. Like you're that mama
Right.
bear, you want to make sure your child is safe. The fact that she even had courage to come out to say, "Oh guys, I need help," it goes a long way. So we
Right.
need to validate our protection. We need to screen gently for trauma on our part and possibly refer her, because for instance, this is like a pediatric mental health group like work that we're doing. If we're noticing the signs of trauma and depression or anxiety in the mom, we may have to refer her to someone that would see her, because if not, it's like a waterfall. It will cascade onto the child, whatever undealt trauma that she herself has. So we have to connect her to settlement support program, like Warren said, immigration
Hmm.
and community resources. If she wants her own community, like the community that, from back home,
Related to
or
her
she wants
culture.
to,
Right.
yeah, or because of the trauma, she may want to steer clear entirely from that cultural community. Then also we need to give her strengthen our confidence as a parent, without implying
Hmm.
deficit. Like you're not doing anything wrong. The fact that you had to run is a good thing. You were protecting your child. There's nothing to be ashamed of. There's nothing to worry or you can now be safe. So I think these are
Hmm.
some of the things that we can do in trying to build rapport. Because then if the child sees it's like monkey see, monkey do. If the child sees the mom relaxing in that kind of environment, then it feels like he has permission to relax and, give in to the treatment that we're going to be offering. So that's my
Hmm.
part for that, for rapport building.
Yes, yes. Yeah, so I think we have really covered quite a lot of grounds where that's considered. So I think it's pretty safe for us to look at some of the treatment considerations for the son specifically, and this is a good segue that Patricia made in terms of talking about ensuring that mom is okay so that the son can be okay. So then I'm looking here at treatment considerations. So I'm thinking as a 5-year old that has experienced violence, he may show trauma through behavior rather than words, right? So maybe not being able to articulate as well. So treatment should be basically developmentally appropriate, right? And like trauma informed and culturally safe, like we've been saying in terms, following on from the building of the report. So for example, we could look at a play-based trauma therapy. And the reason why we want to do that, like children at this age, they often cannot articulate, as I said before, their trauma experiences verbally. So play allows them to express that emotion. They can regain a sense of control and process trauma safely. And we all know kids like to play. So this is where we're going to be looking to find these things. This is where we might see these things. So some of the examples of these, trauma therapy could look at trauma-focused play therapy. We could look at child-centered play therapy. We can also look at the sanctuary or art-based interventions, right? Another type of therapy we could look at trauma focused cognitive behavioral therapy, and that's quite a mouthful, right? And the reason we want to do that, this is an evidence based. This is evidence based for children exposed to violence. So we want to make sure that we're using evidence based practices, right? And this particular therapy helps to reduce anxiety, it helps to reduce nightmares and some of the behavioral issues that may occur. And it also helps with emotional dysregulation. So we want to ensure that we're adapting this for a 5-year old, making the sessions shorter, right? Having a lot of visuals, a lot of stories, a lot of play, right? To ensure that we keep the child engaged, interested, sorry, and then they'll be able to, take part, and then we can observe the attitudes that we want to see here. We want to make sure that there is parent involvement to reinforce coping skills at home, and this is spot on with what Patricia was just talking about, right? We have here another strategy that I looked at is the parent-child interaction therapy, and this one in particular helps to strengthen the parent-child bond, right? And it improves emotional regulation again. It helps the child to feel secure. It also empowers the mother with tools to support her son's healing. And again, like I said, it goes right back to some of the points that Patricia and Lauren and Setami was discussing in terms of we just want to ensure that mom is okay. And if mom is okay, I like the terminology that Patricia used. We're going to have that cascading effect, right? Like a waterfall where that's going to pour onto the child. We want to look again at safety and stabilization at work. So, for example, we're looking at mom again. Before trauma processing, the child may need some predictable routines. So, we want to make sure we set up some routines to get some amount of stability back into their life, because they have to uproot, flee, whichever country they are fleeing from. And so, there's a lot of, chaos and disruption of routine. So we want to build some predictable routines. We want again to look at emotional regulation strategies, some breathing techniques, some sensory tools, and all of that will play into that. And then this is the last one I'll touch on, and I'll just leave the rest for Patricia to discuss. We want to look at a safety plan that helps him feel protected in his new environment, right? And this is going to be huge because now he's pulled from the familiar into a new environment, and that in itself can be traumatic. So we want to make sure that we have a safety plan in place that helps him feel that sense of protection in his new environment. And I just want to leave the other points for Patricia to expand on.
Roxanne, I don't know what other points you're leaving for me. You practically said it all. So I'm just going to briefly go over my part of what I think I would want to focus on. You focused on
Okay.
safety. You also focused on the therapy, like the trauma focused cognitive behavioral therapy modified for that age. So it's very wonderful. The play therapy as well. Now, one thing I also want to look at is what is the child presenting with, like what are the presenting symptoms, what can we see, is there regression, is the child bedwetting, because usually at that age, not like they don't bedwet, but it's not very common, but because of trauma, kids can regress in learned activities that they've already been like overgrown, you know are there signs of PTSD symptoms? We can get that from role plays, like you mentioned with the play therapy, trying to role play safely um, trauma and seeing what the child's response is. Is there developmental regression, like I said? And then what are the attachment styles that the child is displaying with his mom? Is he overly clingy, because does he have abandonment issue, possibly because of the violence? He's now grown extra attached to mom, that he cannot see himself thriving outside mom's immediate space. Now, like you said, I'm going to also dwell more on the protective factors that we can strengthen to help him. Not because it's just the two of them in the picture right now, we want to further strengthen the attachment between them um safely. So if this was an insecure attachment where the child is being very clingy, we want to find out to balance that attachment between them so that it can thrive with or without mom. Not to say that mom is always going to be out of the picture, but such that if mom is not there, if it's in a class or in daycare, it can do well. And then when he's gone home, he'll be happy to see mom. We want to also inquire from mom what the cultural identity she wants to have for that child is. Do we want to continue the cultural identity? Many parents will be like, okay, we've come from another country to this country, but I don't want my child to forget where they're from. But in that case, it may be a
Mhm.
case where I want him to forget. Like, I don't want him to ever think of that part, perhaps because she fears that it might trigger him. So we want to identify what the cultural continuity is going to be. Then we want peer connection because is of school age right now. I know in Ontario is of school age. So we want to check how we can place him in peer environment where you can see how other kids are behaving, where you can have a sense of community and belonging amongst his peer. And then we want to have a structured daily routine for this child because this has been a child that has experienced significant trauma. Excuse me. We want him to now feel a sense of um independence to an extent. We want him to feel like a sense of stability, and we can start that by ensuring structured routine. When does he go to bed? When does little things like this can help to shift a child's pattern to know that, okay, I'm safe now, and can help to address that. So we want to also collaborate with school and daycare depending on where he is. If applicable, we want to inform the staff. If the mom gives us consent, we need consent for this, so that in case the child maybe throws a tantrum, it's not labeled, because people, what they don't know, and it may not be the labeling based on like okay, but it may be labeling based on ignorance. If they knew where he's coming from, what his background is, there may be graces that are given to him. But if a child is just throwing a tantrum in the class, the teacher or the caregiver doesn't know where that is coming from, they may be very quick to label. But if they understand that this child is coming from significant trauma, is a new immigrant, it just needs a little bit of help, it can help. So we also want to watch for and behavioral and social withdrawal signs. If the child is getting better now and then is beginning to withdraw, or what are the behavioral signs that he's experiencing? Some children, some of their trauma symptoms could be that they bite other kids, they are very irritable, they don't want another child to hold them, they're very possessive, they hold on to toys. These are some of the things that we want to check. What are his social cues? Is he able to relate well with kids' age? And we want to also provide, like I said, predictable routine, because children generally need nervous system stabilization, and then they can begin to experience safety. So I don't know if anybody has anything to pitch in, or we could just wrap this up with what we have learned so far or discussed so far.
Well, so I had a couple more points. Maybe you probably have said it in like assessing how migration stress, and I think you mentioned the language barriers, and also the loss of extended family support, right? Because remember, they would have left other family members wherever it is that they're coming from. So that loss of family support too can affect the child, right? So that's one of the things we want to assess for as well. We also want to in the play we want to incorporate culturally meaningful practices like some of the songs they would use, some of the stories, rituals. We want to weave that into some of the family sessions that we have, if the family wishes. And I really like Patricia saying we have to make sure we have to think, because sometimes we might be thinking that they want to remember these pieces, but possibly they could want to forget it. Am I safe in saying so? Right? They may want to forget this because of the trauma and what they had to flee, right? And once the mom feels respected and included in all decisions, right? Because there are times when I can see where, decisions are made and the parent may not be so included. So we want to ensure that mom feels respected and included in all the decisions that are going to be made. You want to make sure you have the settlement services. I know, like for here in Barry, you have like the immigration, the local immigration offices or the newcomer offices they have here. Some of those are things that I think could also tie into what everybody has discussed. Is there any comment, anything Satami or Lauren want to add to this in terms of treatment?
Okay, yeah, thank you very much, ladies. You guys basically said like a lot of interesting points, and there was a point that Patricia made about making sure the mother is also involved in the child's care, and I really agree with that, because when you support like the mother's mental health supports, like when you support the child without supporting the parents, that like it will be very, very incomplete, right? So the mother
Yeah.
also might need individual trauma counseling. We can also like you said, like Roxanne said, we can introduce her to social worker or like communities, that support refugees and newcomer. And also, if she's comfortable with her consent, we can also introduce her like to peer support groups and also community integration services. And for the child, also want to do what we call the parent-child therapy. So like children that are exposed to violence, just like how Patricia said, they become like they can start bedwetting or things that they've stopped before, they can like start developing them again. So when children are exposed to violence, they develop like deregulated behavior. So this parent-child interaction, they can actually support, like they can be secure attachment. Oh, my mother is there, so I'm okay. Emotional coaching, and also there can be positive parenting skills. So like this, even if we involve the parents with the child, it actually empowers the mother also, and it's an helper in dealing with any trauma that she's going through. So this, and I like you guys mentioned play therapy too, and this is very good. When you watch the child, you know what the child actually lost, because most kids at 5 year old, if the child doesn't have any underlying diagnosis of autism or anything, they are always like anything they see toys or anything, they like really, really want to be involved in it. So through like symbolic play, children like process trauma safely. So when they are involved, when they involve the child, when we involve the child in like a age appropriate play, it actually reduces the anxiety, and it will actually improve emotional expression. And we can see that the child begin to feel like a sense of control become to be restored to the child. So and I would say for a 5 year old, like play therapy, like Roxanne and Patricia said, for a 5 year old, play therapy, like we are going to look at it like is the major primary goal, and how we can actually help this child in navigating that. That's anxiety. So we have given brilliant points. I don't know if any other person wants to add something. We're really giving brilliant points for this case. And it's also sad that many people, and this is like in reality, I've seen people that, come from different backgrounds, like we don't know kind of violence, maybe marital violence, or, just violence. It's very sad when you see them go through that. So, like we said, majority, as a majority, like we said, the most important thing is safety, because when they feel safe, they're able to express themselves. So it's a sad thing, and which actually happens in reality. I just hope anyone that is going through things like this can be able to be comfortable to share and to speak out, because it takes a lot of courage to speak out, because some people, they don't want to be, they might feel like they might be judged. So it takes a lot of courage, like we said, for this woman to speak out for her and her child. So yeah, brilliant points we've given to this case. I don't know if anybody has any other thing to say. Thank you, ladies.
Yeah, totally agree.
Yeah, I think you guys pretty much covered all the points that I had as well. I do agree with the play therapy. The trauma focused cognitive behavioral therapy, I think, is a good one. And I don't know if it was Roxanne, I think it was Roxanne that talked about safety plans and just keeping up with ongoing assessment and monitoring, I think is important.
Mm-hmm.
Um, and especially just establishing, I think Patricia went over predictable, like daily routines, like meal times, bedtimes, and maybe just some new family activities that can restore a sense of normalcy and safety, I think is
Mm-hmm.
important for like children that might have been previously in like chaotic or threatening environments. So I think that would be good for this case. But other than that, yeah, I think you guys pretty much touched on everything. I don't want to repeat the
Mm-hmm.
points too much, but does anybody else have any last little bits they want to add?
Yeah,
No, I think it's
so
all
in
good for
general,
me.
oh,
Yeah. Go
sorry,
on.
go ahead, Patricia, go
No,
ahead.
no, I was saying it's all good on my end too.
Yeah. Yeah, like I said, as we summarize, um, I think one of the biggest issues here that we all agree on is that sense of safety, because when you're fleeing trauma, I can tell you, it's that sense of safety and trust. You're going to be so hyper vigilant, right? You don't know who to trust, you don't know who to go to. You're always on the watch, right? So, like Satame and everybody has really said, we really have to validate mom's strength and her bravery for at least coming forward to seek that help, and that is huge on her part, right? And I think we have really come up with some good strategies and points here to really support this family, right? This mom and child, to really ensure that they feel safe in sharing, to feel safe, to address everything from a cultural lens, to make sure that we build back some amount of routine, like everybody is saying, to make sure that we have different groups in the community. And we do have a lot of groups in the community. Like right here in Barry, we have the Newcomer Welcome Center, and we have a ton of, the community is growing. So we have a different groups. So we want to find out what's the cultural background and make sure that we're connecting them to some kind of cultural group, right? So that they can all, if that's what, and that's a big question. It's always that if, right? We want to make sure we give choice. Speak to mom to find out, is this what you want? Do you want to be connected back to that cultural group, or is it that you just want to be away from that because it's going to bring back too much memory? So a lot of asking, question asking, a lot of giving choice, a lot of listening, right? A lot of trying to be empathetic and understanding the needs of this family. And I think we have explored that extensively, from all different lenses. So I think at this point we could, ensure that we put this on the table for now. And when we reconvene for our next meeting, then we can do some follow up. Is everybody in agreement with that?
Yes, thank you so much,
Yep.
Roxanne.
Yes, thank you so much, Roxanne, and thank you, ladies.
All right now.
Okay. All right. So with that being said, then I think we can call this meeting a wrap. So thanks everyone for again for a wonderful collaborative meeting, for everybody sharing, their different points, sharing from your expertise and your different lens. I think this was a very fruitful meeting, and so we can reconvene we can kind of just break here and then look forward to the next meeting. Thanks,
Okay.
Lauren. Thanks, Patricia.
Thank
Thanks,
you,
Thank
Stephanie.
everyone.
you.